remember I would look in the mirror in hotel rooms just staring at myself like, who are you? And it just felt like I was nothing. I grew up mostly in a dysfunctional home. No consistency or stability. Drugs and alcohol were very common and were really the norm for me in my household. I didn't recognize that there was people in the world that didn't have my best interests at heart. Without realizing it, at the age of 17, I was being groomed for the life. I didn't want to do it. My trafficker knew where my mother lived, and that's where my daughter was. And he would say, if you leave, I'm gonna kill you or I'm gonna kill your family. Being trafficked was like a scary dream that I could not wake up from. I knew I needed to get out, but I didn't know how.
88% of trafficking survivors reported they had an encounter with a healthcare provider while they were being trafficked, with 0% of them being identified. And so being able to recognize them is incredibly important because that's how we can help get them out of their trafficking situations. The Human Trafficking Response Program that Dignity Health has set up, all of the staff throughout the hospital system, everybody from the janitor through our front desk staff, every medical assistant, our nurses, all of our physicians have been trained in victim-centered trauma-informed care, and they've gone through extensive human trafficking training.
In retrospect now, because of the training, I realized some of the patients that I may have encountered, that I may have been frustrated by, were probably victims of human trafficking. And that's why the training is so important, right? Because it shatters these preconceived notions and these ideas and these misconceptions that you have, either as a healthcare provider or someone in the community. It's happened with every provider here where it gives you pause and you think, gosh, I wonder if the reason that patient was so abrasive or uncooperative or unable to give a history was because of the trauma they had undergone.
The trauma that they've been through has been so severe for so long. They're gonna need time to recover. And so we're able to help get them resources and access to care.
When I first started to realize that I had PTSD, things were happening when I didn't want to even be touched. I would have these moments where I would just literally cry uncontrollably. And I didn't understand why this was happening to me. With trauma, your body keeps the score. I knew I needed to seek professional help. I've been seeing Dr. Chambers for 3 or 4 months, and he's really kind and compassionate and didn't make me feel uncomfortable. I feel like it's really important for medical professionals to be trained while working with trafficking victims and survivors because it allows people like me and so many others to feel comfortable to receive the help. It's also helped me become stronger and face myself. My life today is unbelievable. I have a great family, a great husband, daughter's amazing. I'm living my dream.
The Human Trafficking Response Program has made me a better doctor. Every patient I've seen has been affected by my training. It's really taught me an incredible amount of patience and listening and really see them for who they are and what their story is. And I think that can't lead to anything but better treatment.